Welcome everybody to the Lake Norman Chamber of Commerce Special Focus Friday today, handling the stress of COVID-19 and the impact on business and family, particularly those business owners, those managers, and those employees. It's been a great 2 weeks of Lake Norman Chamber of Commerce activities honoring our small business community. We've had a fantastic week this week with our 3-night seminars, and then yesterday a seminar on selling. But it has been a fantastic 2 weeks of small business events. This one is going to be fantastic, and Jeff Tart, our 2020 Public Policy Chair, is going to lead the discussion. Jeff, I'm going to turn it over to you.
Bill, thank you very much, and appreciate everybody for joining us this morning. This morning we're going to be talking about the implications from a mental health and behavioral health perspective that the COVID-19 pandemic is having on our community, particularly from a business perspective and individual implications for that. This morning we have two really renowned healthcare professionals in this field that are experts. Joining us this morning is Dr. Michael Clark, who is with Novant, who is a psychiatrist by training and works in the integrated care psychiatrist area for Novant. Also joining us this morning is Dr. Carla Lever. Dr. Lever is a trained and professional counselor and working with other counselors, and they both work in this field every day. So what we're going to do this morning is start, I believe, with Dr. Clark, and we're going to go through a presentation from both healthcare professionals, and then we're going to open it up to a conversation and have a little dialogue around some of the issues that they note this morning. So with further ado, Dr. Clark, I'm going to turn the floor over to you, please, sir.
All right. Glad to be here. Let me see, we got, well, anyway, yeah, thank you for asking me to give a talk on this topic. I mean, obviously, it is topical, you know, since we're living through the COVID pandemic right now. You know, I just wanted to go through, you know, a couple of items and kind of how I'm going to structure this brief talk. If we can go to the next slide. Yeah. So first of all, you know, I just wanted to, you know, kind of define the impact of the pandemic and how it really impacts on mental health kind of across the board, and kind of what makes it kind of different from other types of stress that we might experience. And then I want to go and, you know, focus on, you know, particular personal family issues around this COVID-19 pandemic with respect to behavioral health. And then also focus on some leadership tips in going through this crisis, and you know what to share with your employees and stuff. One thing, what makes it really impactful is there's you know, 3 areas that overlap and really create a big impact. One is the uncertainty and you know, the loneliness, the isolation that this pandemic has brought upon. And, you know, with, you know, they talk about the medical footprint of COVID, but the, you know, psychological impact, you know, or footprint is much, much broader because, you know, even though only a small percentage may be directly affected, you know, the worry and uncertainty is a far greater impact on a lot more people. Then around this, you know, we're looking at trauma and loss, you know, particularly with people who are most vulnerable and sick, elderly and whatnot. And then there's, you know, just the heightened stress in general with, you know, changes in routine and also, you know, something of a decreased access to care, at least face-to-face care. Next slide, please. So I just wanted to go through some of the responses. You know, a lot of the material that I've pulled from comes from the American Psychiatric Association, CDC, and also for the Center for Study of Traumatic Stress. Yeah, I attended a presentation several weeks ago, and they really, I think, pulled together a lot of nice stuff around these issues. But as far as kind of responses to COVID-19, of course, there's the regular response around stress, problems sleeping, not feeling safe, a lot of what are called physical symptoms and stuff, headaches, upset stomach, that sort of thing, increased irritability and anger. And then, of course, with increased anxiety, people tend to be more distracted and unfocused and stuff. So those are kind of just general stress reactions. And then we have people who are, particularly vulnerable. I mean, people who already have mental health issues, such as, people with depression, people who have been through traumatic episodes before, people who have anxiety disorders. And then on top of that, you'll have, a different population with those who have problems around substance use. And, with increased stress and isolation, could lead to increased use of alcohol or other substances, and also, might lead to, even those who are at risk, could lead to greater consumption and use. So what do we do to try to kind of lessen the impact sort of personally? Some of this is straight common sense, is really taking care of yourself, getting good sleep, getting good nutrition, staying well hydrated, really engaging in different kind of calming strategies. It can take a quiet time for yourself, whether that involves prayer or meditation or just some sort of relaxation or just chilling out with some tunes. Also, just staying informed, but not being overly informed, using the media wisely. It's too easy to get on, a feed on social media and just keep scrolling. And since there's so much uncertainty around it, trying to get absolute certainty through that means is really impossible. And then you start getting conflicting messages from differing people. So stay informed, but I would say, limit what you're watching or reading to maybe just a couple times a day. The news isn't going to change all that much, and really confine it to, reliable sources. As far as, CDC, SAMHSA, real vetted news sources. I don't need to say, I wouldn't accept any news items from Facebook or whatever as absolute fact just because it was on the internet, but just really focus on what to be, legitimate sources. And then I think it's important to develop new routines. Our whole routine is upended here. So trying to get a new routine, a regular schedule going while you're at home. Personally, I've had to rearrange my, workout schedule. I used to get up, in the early morning with the guys and do some workout, but obviously that can't happen. So I've had to, develop a different sort of running routine in the morning and hook up with some of the guys via Zoom, and then get on to work, and then, try to set a regular schedule around work and home, and do that in order to bring some normalcy to your life. Next slide, please. Also, and I think Dr. Lieber will agree. I think the idea of social distancing has been, that name is a mistake. What we're really looking at is physical distancing, but still maintaining the contacts. Because, we're social animals, and we need to talk to people, to coworkers, to friends, to family. And fortunately, we have technology working for us. I mean, I would say, a few months ago, people were seeing, technology as the enemy, as far as people FaceTiming each other and seeing each other virtually. But now it's, it's a godsend as far as being able to keep that contacts going. I mean, and again, I'll just say personally, we just kind of introduced the whole family and the older generation to Zooming, and seeing my mother-in-law's face light up when she could see us via Zoom was something that just made it all worthwhile. Keeping up physical activity, taking a tour around the neighborhood, saying hi to family and friends in the area, allowing yourself time to kind of think and process, and just also remembering that in this time where we're physically isolated, we're really all in this together. I mean, I think everyone is experiencing a lot of the same problems, and the stress that we're feeling during this time isn't really unique to us. Where it comes to working with kids within the family, basically, helping kids to really understand by just providing just real basic information so they can make sense of what's going on around themselves. I think nothing can be more disturbing than everyone's routine being upended and then not offering the kids, an explanation of why that's happening. And I think that's an opportunity for a lot of increased anxiety and worry around the kids. The other thing to consider is the child's age when you're talking to them. A teenager may be able to understand things almost, pretty much at an adult level, but as a small child, they don't understand. They may not even understand they certainly don't understand the risks, but they can understand what it means to get sick and how it feels to be sick and how they don't want others to be sick, and that's why we're wanting to do this. Being calm and clear with your children, I think, is important. Kids are masters of reading their parents, and so what you say, your body language, all that is very, very, very important to be able to impart a sort of a calming reassurance for them. And also, creating a shared understanding, being able to talk about what we all can do as a family to keep ours and our loved ones safe. Why we have to wash our hands, why we have to maintain physical distancing, and but also understand that we don't have to be alone and that we can contact people in other ways. Moving on from family to business. Again, I think a lot of these things are areas that y'all are well aware of and make common sense in any sort of crisis change moment. I think one of the important things is to be present, to be visible, to connect, to communicate, to reassure, to know that, that you're on the job, on the spot, and kind of sharing in what they're experiencing. Communicating effectively, I think, is key, making sure that you have all the answers, all the necessary answers, and also making sure that the communication is consistent, across the organization and across the community, because I think nothing is going to throw people or employees or subordinates into more chaos or crisis if the person at the top is saying something different from, say, the CDC or political leaders or whatever. Then it's like, who do I trust? Who do I believe? What's going on here? And I think the last thing we want to do is undermine trust in those people in authority. Making sure that Of course, there's the equipment needed that for the jobs, whether that be masks, sanitation equipment, soap. I know y'all have probably soap, but if you have the Purell or whatever, just making sure that everything is out and available. Encouraging self-care. We've talked about a few of the tips to maintain that. And there's a lot to be said, for making sure you're taking care of yourself first. Like they say, in the drills on the airplane, when the oxygen masks drop, put yours on first, and then go ahead and help others. Of course, you want to lead by example, normalize the reactions. We talked about it being in this everyone's in this all together. Everyone's experiencing a lot of the same stress, the same worries, the same concerns, the same restrictions. And, talking about it, normalizing it, I think makes a lot of sense. Also having, resources available for these this time of increased stress, is important. And later on in a couple slides, I'll show you some other resources for that. Addressing grief, if recognizing, when some people get sick and being able to offer condolences and support, but also, if a person is to pass, not to sweep that under the rug, but acknowledge it and give everyone a chance to be able to share and support in that. And the last thing is looking at being forward thinking, being realistic or hopeful. And, that's a delicate balance. And I have a slide up ahead that will address that more clearly. This is the slide. The thing is, it's a delicate balance, between recognizing some of the severe issues we're dealing with now, but also, providing hope, knowing that these problems are real, but, the problems can be managed. People are going to get hurt. There's going to be hurt that needs to be acknowledged. But that has to be balanced with the idea that, this is eventually going to end. Most people are going to do well. And we have to be able to balance the ill with the good, being able to talk about the things that are happening in a positive way and maintaining hope, maintaining that hope in the community. And, and what's balancing this all out is the messaging that we give, that our community gives and our family gives, to be able to have a sense of realistic hope. Next, please. And these are some of the resources and that we can rely on. I mean, the top 4 or more kind of national resources that people can reach out to if they need immediate assistance. There's a disaster distress helpline that you can call either directly or text. There's a National Suicide Prevention line. Again, they have a number that you can contact, as well as a text service. There's a crisis text line. And then for those of you all who serve, there's also a veterans crisis line that has both direct calling and texting capability. As for my own organization, Novant Health has a psychiatric resource call center that has the number below, that has people manning these phones, licensed clinical social workers 24/7, who can really assess what's going on, what's the level of care, and help direct people to the right resources. And again, these resources aren't necessarily solely within Novant, but they have a whole database of resources across all of Mecklenburg County. So if if you need something, not sure where to go with it, whether it's mental health, substance use, something to talk, Christian counseling, they can parse this out any which way based on insurance and resource and whatever. So want to throw that out there. And I will be quiet and let Dr. Lever take over from here. So.
Thank you so much, Dr. Clark. Those were really great points. So we will go through my slides and I'll just hit on the things that you didn't touch on. Next slide. So if you take a look at these 4 studies, you'll see that people really truly have been impacted both with symptoms of anxiety and depression, as well as an increase in suicidal thoughts and self-harm. And it's about, because of many of the things that Dr. Clark was talking about, social isolation being a huge one, also worries about the financial impact, whether they're working or not. Because even if you are still working, you can see that maybe we're going into a recession. So people really have been affected. If it's not you, and if it's not your family members, it's going to be your employees, and it's also going to be the customers and clients that you serve. Next slide. 1 in 5 people in their lifetime are going to experience a mental illness. Now, I know that the word mental illness is very scary. All it means is that somebody's ability to live, laugh, and love has been impacted to an extent that it is diagnosable. Most people are going to be impacted by anxiety or depression more than any other mental illnesses. But if you think about all the people you know, now I'm not asking you to diagnose the people that you know, but if you think about it, 1 in 5 of you are going to experience that in your lifetime, which means that it is very, very common. Next slide. And here are some of the things to look for. I think most of us know the symptoms on the left-hand side. But what many of us may not know is that most doctor's visits in primary care settings, a very large percentage, I think it's like 70%, are actually for physical ailments that have to do with anxiety or depression. And very often, even the patients themselves don't know that they are going to the doctor because they are experiencing anxiety and depression. So right now, everybody is experiencing a little more stress, a little more anxiety. And so these are some things to look out for, the things on the right side. Next slide. In addition, alcohol sales have gone up 55% in our county. 55%, that's a lot. Some people may think that this is a fun idea, and it might be if you're doing it in moderation. But of course, the more that you drink, the more that you use drugs, the greater you are at risk to develop a substance use disorder, which is something that is going to interfere with your life. And also what's been very hard, I think, for people who already had a diagnosable substance use disorder is that right now, many of their coping skills are not available. So it's very difficult to go to things like AA, to go to NA. A lot of treatment providers have shut down or gone to just virtual. Ours is still open, and there are many that are still open in the area. They also are at higher risk for medical complications because of the damage they've done to their body from their substance use. So all of this is happening, and the very sad statistic at the bottom, there have been a lot more overdoses in our area during this time. And why is that? That's because we are all grieving what is going on. The Harvard Business Review said that we are grieving the change in normalcy, the fear of economic impact, and the loss of personal connection. And I absolutely agree with those. And I want to share 3 more. We're also grieving the loss of perceived control. We had an innocence in thinking that we knew what our daily life was going to be like. We've also had a loss of perceived safety. And all of us have been imperfect during this time. I know that I have been, and I feel like I'm grieving that. But some things you can do to get through that is to remember, just like Dr. Clark said, this is impermanent. Stay in the present. Understand what we can control. I know The idea of control is really very compelling. It's really great to think that we are in control of our lives. But I always think of it this way. Remember when you were 13 and you just knew that you could rule the world? Well, what if you had ruled the world? It would have been awful, right? And the same is true now. If any one of us could control the world, it would be terrible. So that's why it's good that we don't have a lot of control over what happens to us, but we do have control, if we're healthy, over the way we think about it and what we do and think in this moment. Have self-compassion and compassion for others. I heard somebody say on a call that this is the season of grace, and I completely agree. We need to be giving grace to ourselves and to everyone else. Allow your employees and yourselves to grieve this transition. You know, a lot of you have been working from home, and a lot of employees have been working from home. As far as I know, all of you could be wearing pajama pants. I don't know. And people might miss that. People might miss waking up 5 minutes before they have to start work. So all of this transition is difficult, and understand that people are grieving, including yourselves. There will continue to be fear about the future because we just don't know how this is going to play out. So for leaders, remind your employees about the value to their organization. Help them connect to purpose. And really seriously think about how you led during this time. I know that for the first 3 weeks or so, there was so much information being filtered through me. Was gathering all this information, and then I had to make sure to get everything I needed to get to all of my employees. That really, that was all I was doing. I was not being the engaged leader that I typically am. And so after those first 3 weeks, when I sort of caught my breath, I evaluated what I had been doing. And it's still good to evaluate what you're doing. Were you available to them? Have you been as transparent as you can be? Have you helped them produce the solutions that they need? But it's a season of grace, right? So even if you haven't, next slide, now is the time to do those things. Now is the time to listen to them. They have amazing solutions. Attend to their needs. Sorry, I had to make that bigger on my screen. Suspend judgment about their mistakes and your mistakes. Truly appreciate them. If you do all these things, there really isn't anything that you can't get through with them. Your team is really important. So what resources are available? Well, I think people of this community are very lucky. There are many, many resources. Atrium has resources, Novant has resources, and there are other really wonderful resources in the area. If you want some employer-specific solutions, I'm the director of the Employee Assistance Program with Atrium. If you're interested in that, you can contact me afterwards. We also have a lot of other employer solutions. We give free mental health first aid trainings. We have a Healthy Minds program. This is an integrated program and other employer solutions, but I don't want to make this an advertisement, so we'll move on. There's National Suicide Hotline, and we also have our own behavioral health call center. Matter of fact, that was my first job with Atrium, so I can tell you that when you call there, it's staffed with all people who are clinicians, and they do care about what's going on with you, and they will listen. And just like Novant, we will also not just direct you towards our services, but all the services in the area. Next slide. We are open. We want to help you. Everybody who is working in this field really is concerned about you and wants to help you focus, wants to help you improve. Thank you so much.
All right, Dr. Clark, Dr. Lever, we thank you so much for the material. Well, we're going to need about 3 hours to cover all the things that you've just raised in my head that we need to cover. First of all, I do want to say 2 slides, one in each presentation that really stood out. Dr. Clark, the one on the leadership in crisis, seems like just a magnificent checklist, almost on a daily basis for leaders in their business. And then Dr. Lever, the one that you covered on the retaining and building credibility, that almost could be in a MBA program course. Strikes me as that, again, a good checklist, even post-pandemic, that CEOs and the C-suite executives and business owners should be paying attention to. But if we can, let's jump back for a second to the classic mental health issues. And can you guys talk a little bit and distinguish the difference between anxiety and stress, if there is such a difference, and how do we, and what are the recommendations on how do we disconnect from the stress that's building up?
You want to take that one?
I can start with the difference between stress and anxiety. So stress is a normal part of life. It is actually important for us to feel stress so that we can take an action. Prolonged periods of stress can cause anxiety and depressive symptoms. Anxiety is the feeling of anxiousness, the feeling of worry, and there are physical symptoms that go along with that. The difference is stress is a force. Anxiety and a diagnosis of anxiety is what's going on inside, and it becomes a problem when it is affecting your ability to function. So short periods of stress are normal. Resiliency is normal. Everybody has been through terrible things and survived it, but sometimes we just don't have what we need in the moment to be able to move beyond that difficult experience. And that's when our resiliency needs some help. And that is when we're going into anxiety and depression, is when we cannot seem to move through a difficult situation.
So again, ideas on how we can reduce stress, how we can relieve anxiety. What are the things that we're able to do day to day to help that?
Well, one thing, you always hear about the Serenity Prayer, about, God give me the grace to know what I can't change, what I can change, to be able to know the difference, and I think that's important, because I think we can only affect, we can change what we can change. And I think we need to be, to address the anxiety, we need to be active in some form of solutions. One of the slides, we talked about helping others find solutions, and not giving people solutions, being able to find some solutions, be able to be effective within their own household, within their own workplace. That's going to relieve the stress and anxiety. But also acknowledging it, knowing that this is a stressful time, acknowledging it, bringing it out in the open, rather than kind of keeping it bottled in, isolated, unaddressed. That's probably not a good strategy to be able to address those things. And then doing whatever it can, as I talked about with the self-care, getting your sleep, getting your good, good appetite, staying well hydrated, maintaining some activity level, just trying to maintain some level of normalcy and routine in this time.
And if I may add,
Sure.
being kind to yourself and truly looking at the things that are going well, looking at how you're doing things that are going well. That is something that I think most people have the most difficulty with, is taking care of yourself with that kind of kindness and grace.
Well, we see the difficulty of sometimes people just being kind to others, right? As well.
Yeah, right.
And I will take that into an example that is a stress producing activity that I'd like us to talk a little bit about, because it's an abnormal action that we do, and that is the requirement, or at least the recommendation, that we wear masks. Can you talk to how people need to adjust or can adjust, and why people have an adverse reaction to wanting to wear masks?
Well, I would say, and I don't think I need to speak to the kind of the necessity of this time to wear masks. The primary reason for people to wear masks is for those who are infected, not to spread it, not to necessarily prevent you from getting it. And with the masking, if two people are masked, the chances of contagion are like 1%. And, you know, there's a great informatic that shows what happens. And if one person's infected and you're not wearing them and they're wearing a mask, or they're not wearing a mask, you're wearing a mask, your chance of infection is 70%. So it reduces it a little bit. But if they're masked and you're not masked, it goes down, I think it's like 5%. So really having everyone masked is the best way to go. I think the anxiety producing part of it is, one, it's uncomfortable, you know, it's harder to breathe. The more effective masks are going to have a filter, and it's going to make it harder to breathe in and out. You're not going to be able to read people's facial expressions as easily. So it makes communication that much harder. And I think that's another reason people don't want to do it. And then, you know, there's some stigma attached to it. You know, I was, you know, certainly say in the African-American community with people going around wearing masks and what people are afraid might be perceived when a young African-American male comes in with a mask and stuff like that, and what might result from it. So I think all of those things come into play when it comes to masking. And I think it's just up to us just to kind of normalize the experience and to be leaders in it, and just to say, you know, this is the way we're doing business right now. You know, we care about ourselves, we care about our customers. We're going to do this thing. And I'll say, you know, with you know, within our, you know, my organization Novant, having that visible visible presence in masking and cleaning constantly in the public eye has made a world of difference as far as people's perception about clinics being a safe place to go to. And you want your businesses to be perceived as a safe place to go to, and having those visible signs, I think, is important.
Well, as the stress and anxiety increases, I think I've been reading where suicides are more prevalent. Can you, and it's particularly for business owners and other folks that are, once we go back to work, or even where we're social distancing, essential employees, hospital workers and stuff, what are the signs somebody may have a proclivity to taking their life, and how do we identify those and keep a watchful eye out to help others in that area?
Well, there certainly are many signs. Typically, somebody will appear depressed for some time before something like that happens, but not always. Very often they will express the thought that they're thinking about taking their lives, or they may make some passive suicidal comment like, I wish I weren't here, or you won't have to worry about me for too much longer, things like that. If anybody hears anything like that, that's an alarm. And it's important that somebody speaks to them. It's also important that you know, as a business owner, that if one or a leader of some sort, is that if an employee then reports that to somebody in leadership, now your company is partially liable if anything does happen. So it is important that you have that conversation and that you use your resources, such as your employee assistance program, or there's a wonderful mobile crisis here in this county, either of these call centers. But if you hear anything that is remotely concerning, you must do something about it. You have to make sure that they're evaluated.
So doctors, from both a COVID perspective as well as a suicide, some of the resources available are hotlines now. Can you give us, because that can be stressful or fearful to make that call, whether you're the person involved directly or somebody you know you're calling on behalf of. What's that experience like? What if you call a hotline, what's going to happen?
Well, I worked at one.
I was going to defer to you since you have hands-on experience. Yeah.
I worked for one, and I worked for the one at Atrium Health, and it was actually a really wonderful experience. It was a good training experience. So they taught us that, you know, you may only have a few seconds to be compassionate, to offer assistance to someone. So when you answer the phone, they're going to be speaking with somebody who is compassionate, who does care. They're going to ask questions. They're going to find out where you are. both emotionally and physically, and then they're going to try to direct you to where you need to go. The thing you need to know about people who work at hotlines is that, you know, they're not in it for the money. They're doing it because they really want to help the people that need their help. And they have a wealth of knowledge. And they're used to talking to everybody, family members, the patients themselves. You know, I could be on the phone for 30 minutes before a patient actually would speak to me because I'm talking through a family member. They're very flexible. They will do whatever they can to help you.
A kind of a related, one more topic on that is, and you guys mentioned it earlier in the presentation, is the topic or concept of coping skills. What are those, and how do we learn what those are and how to apply them?
Well, I touched upon a number of those things, as far as sleeping, keeping active, being able to take some time to yourself, to be able to kind of think and process. I think keeping your lines of communication open for those who, you count on, being able to reach out and say, I think is an important coping skill. What's going on with you? Anything I can do to help you? Here's what's going on with me. I could really use some help along these lines or some advice. So I think all of these things can be very useful coping skills, because we're not in this alone. We have a whole village we can draw upon. I mean, your organization probably can be an example of that, where people can lean on each other for help during these times. I don't know if
that's very helpful information and guidance. One thing, and we're going to pivot a little bit, because with the pandemic, as we're doing now, we're holding this meeting virtually and using the Zoom technology. I want to talk a little bit about telehealth. And I know Atrium, for example, has created what they refer to as the virtual hospital. I know doctors, physicians, primary care docs are seeing patients either talking on the phone or by video. Can you tell us a little bit and talk to where telehealth is appropriate and can be used effectively, and maybe areas where it may not be effective and you still need to be able to be in front of a healthcare provider?
Well, Dr. Lieber could probably bear this out. One thing that with telehealth that's hit its stride is with behavioral health. As far as with psychotherapy, counseling, even with seeing psychiatrists, that's been pretty helpful. Those areas where you don't need to do a detailed physical exam, you don't have to get a blood pressure right then and there, or listen to a person's heart or lungs or whatever. Where it's more or less routine, or there's a concern or whatever, then I think the telemedicine option is good. Where it's not good is I think if a person's experiencing physical distress, and they need to get thoroughly checked out and make sure that of what's going on. And that's why, in large part, Novant Health has been opening up their clinics and their services more and more to face-to-face, because with the urgency of addressing COVID, people have been neglecting their physical health and being able to come in and be able to address that. And we look at our emergency rooms and whatnot, and it's like, well, where are the heart attacks? Where are the strokes? People aren't coming in, and then they're waiting too long and stuff. So I would say, if there's some physical distressing problem or concern, that's where more face-to-face a face-to-face sort of appointment is much better suited.
Dr. Lieber, additional comments or things you would share in that area?
I would agree. We are also opening up and we're starting to see more and more people coming. I agree that I'll speak more to mental health because that's more my area. Many people have been very happy with virtual and telephonic counseling. Not everybody, but many people actually are speaking more openly because they're being able to do it from their own room, from the privacy of their own home or while they're taking a walk. But for mental health, it certainly has been a good opportunity, I think, for the United States to embrace this type of therapy. I think it has been helpful.
From a mental health perspective, countywide, at least within Mecklenburg County, what's the interaction and sharing of information or collaborative nature between the health systems, the different providers, and more importantly, is there conversations in this area with the public health department and Gibby Harris, or is that an area that doesn't need to be addressed at that level, or is it something that, you know, we should be doing more of? Any insight to that?
Well, you know, I know all the health systems and public health have been in a lot of communication and stuff, you know, trying to address things during this time. So I don't know if you're looking at a particular issue, and you know, it could well be, you know, as far as those conversations might be above my pay grade as far as what's going on. But if there, I don't know, is there a particular?
No, not just in general. Yeah, just in general. So, at one area that has been a hot spot for COVID and is a massive area for concern and stress is nursing homes. How do the residents in nursing homes access mental health?
That's a very good question. Do you have an answer? Did you want to say something, Dr. Clark?
No, I mean, you know, it just piggybacks on a couple questions ago. You know, the telemedicine option is well suited for that. And one thing with, you know, with the older population, they're covered by, you know, Medicare, and Medicare has long been the leader in telemedicine, and they fully support it. So, you know, I would say more than any other kind of insurance or payer, I mean, I think this telemedicine option is really well suited for nursing home interventions.
Great. Well, we're kind of getting to the end of our time here, as we're going to again make this available on YouTube and to our membership in the chamber. And is there any closing thoughts or suggestions, guidance you would leave for the groups going forward?
Well, I would just like to say recovery from mental illness is possible, as is recovery from all of this angst that we've had. We are in this together, and we can, if we do all of these things, kind of create the wave of the future that we want to create.
Very nice. Dr. Clark?
Yeah, I think just to, again, recognize that, you know, the situation we're in is temporary. You know, we are going to get through it. We're going to get past it. There are some things that are going to change, and there are some things that will likely change for the better. I mean, just like we talked about, you know, telemedicine. It wasn't an option well used. Now it's likely going forward going to be something that we'll all be using in the future. Now that, you know, now that people recognizes its use. And I think there will be other things coming out of this that we'll find helpful in the future. I mean, as far as, you know, this virtual environment, I mean, I imagine there's a number of you all who are already thinking about, my gosh, this has worked really well. Let's keep this going in some respect, and there's opportunity in this. So I guess what I'll say is, keeping the realistic hope, but also recognizing that, out of crisis, comes opportunity too. And then I think that can be the silver cloud or silver lining with its dark cloud.
Well, doctors, we appreciate you taking the time out of your busy schedules to do this. I mean, you are a wealth of knowledge. You are a gift to our communities for your expertises and knowledge. And I would tell you, as direct care providers that you are, not only didn't really choose a job or a career path, as you followed a calling. And I truly believe we are blessed to have people like you in our community. So again, thank you for joining us today.
Thank you.
And Jeff, we want to again
Bill,
thank,
back to you.
we want to again thank Atrium and Novant for participating today and having their representatives. I want to remind everybody that the Focus Friday program is presented by Novant Health Huntersville Medical Center. And our sponsors of the program, in addition to that, is Business Today, Cornelius Today, and WSIC. They make this program possible. We had a very long list of programs that we're going to be offering on Focus Friday before the pandemic, a lot of them transportation related. As we move back into June, we may start seeing that. Jeff, do you have an idea where you want to take the program in June?
We've got a couple things lined up. One is talking with Secretary of North Carolina Department of Transportation. So I believe that will be our next program.
Fantastic. I want to remind everybody today that we specifically made it a much smaller crowd, but we will be publishing this on YouTube and getting it out there. So later on in the morning, this program will be available, and we will be sharing it with our Chamber of Commerce members and the public at large. It will be available not only through the Chamber's website, but through our social media, both our Twitter and our Facebook. Jeff, again, thank you very much for emceeing this program. And again, thank you for our speakers from Atrium and Novant. Thank you again, Novant, Huntersville Medical Center, for presenting this. And we bid you good day and have a great weekend at the lake.
Thanks, Bill.
Thank you.